Diolch yn fawr. Fe drefnwyd y sesiwn heddiw ar datganiad hwn mwyn rhoi cyfle i aelodau craffu ar yr adolygiad diweddaraf o'r reoliadau Coronafeirws yng Nghymru. Cafodd y reoliadau hynny a'i diwygio ddydd Gwener diwethaf, gorffennaf ar 11/10/20. Ers i'r Senedd gyfarfod ddiweddaf ar y 15fed o Orffennaf, cafwyd cyhoeddiadau pwysig yn ymwneud a chefnogi'r economi, a'r sector ddiwylliannol ac yn ymateb i ddigartrefydd. Ym maes iechyd a gofal, rydym wedi croesawu ffigurau calonogol o ran recrwtio meddygon dan hyfforddiant ac wedi cyhoeddi'r raglen fwyaf erioed i gynnig brechiaid yn erbyn y ffliw. Mae Prif swyddog meddygol wedi ysgrifennu at y pobl hynny sy'n rhan o'r cynllun gwarchod, ac mae 4 Prif swyddog meddygol o dan y Senedig wedi datgan y dylid ymestyn y cyfnod hunan ynysu i 10 diwrnod mewn ymateb i symptomau Coronafeirws neu brawf cadarnharol. Mewn meysydd eraill, mae Llywodraeth Cymru wedi dechrau ymgymhoriad ar y drefn cymorth i amaethwyr ac ar cynlluniau i leihau plastig un tro yng Nghymru. Rydym wedi cyhoeddi datganiadau ysgrifenedig mwyn tynnu sylw aelodau'r Senedd at y ddatblygiadau hyn. Llywydd, I will now focus on the 3 weekly review. Members will be aware that over the past 3 weeks, the outlook for coronavirus has darkened in many parts of the world, from Manila to Bogota, from Australia to the United States. In Europe, the advice of the UK government has been to reimpose quarantine arrangements for visitors returning from Spain and Luxembourg, and regulations to that effect have been laid before the Senedd. In England, since the Senedd last met, renewed lockdown measures have been introduced in Luton, Blackburn and Derwent, Oldham and Rochdale, before last Friday's more general reimposition of restrictions across the northwest of England and West Yorkshire. Llywydd, I set all this out simply to place the state of the virus in Wales in context. Nobody should be under any illusion but that this virus could not return rapidly and adversely here in Wales as well. And to be clear, local spikes in coronavirus have been experienced and continue to be experienced here in Wales. We have ongoing outbreaks in Wrexham. The outbreak at Rowan Foods is, we believe, now fully under control, and the last case associated with this outbreak was identified on the 24th of July. At the Wrexham Myler Hospital, actions continue to be taken to address a spike in cases there. Since the outbreak was declared on the 25th of July, 7 cases have been identified at the Myler as new hospital-acquired infections. No new hospital-acquired infections have been reported on 6 of the last 7 days. The outbreak control team continues to meet daily and is supported by a range of partners, including Public Health Wales and the Health and Safety Executive. Because of these 2 site-specific outbreaks, a decision was taken by local public health leaders to offer mass voluntary community testing in parts of Wrexham. Of the 1,418 people tested, only 11 new positive cases were identified, and that's a positivity rate of 0.7%. Given that the Joint Biosecurity Centre cites a positivity rate of 4% as the threshold for any emerging concern, the focus in Wrexham remains on bringing the site-specific outbreaks to an end. And of course, our TTP system is at the forefront of this effort. Llywydd, there's been a great deal of interest in the turnaround times of tests in the TTP system. In the community testing in Wrexham, over 95% of samples were tested within 24 hours of being received, demonstrating that when such a turnaround is required, the system is geared to provide it. And indeed, last week, the highest ever number of tests in Wales were completed within 24 hours. Now, of course, local flare-ups generate cases that contribute to the overall assessment of the position in Wales. Nevertheless, in the immediate run-up to last week's review, the R number in Wales was estimated to be between 0.6 and 0.9. In a model published on Friday last, the R number for Wales was calculated as being lower than for Scotland and for England. Although the lower the circulation of the virus, the more volatile the R number becomes, which is why we rely on a wider basket of indicators, including the results of testing. And in that regard, last week, 41,451 tests were carried out in Wales, of which 0.8% were returned as positive cases. Tens of thousands of tests have been carried out on staff and residents in care homes, and in the past week, the positivity rate for staff and residents there was 0.3%. The conclusion drawn by the Chief Medical Officer from all this data, as set out in his assessment published alongside our changes last week, is that the virus has been so effectively suppressed in Wales that further easements were justified on public health grounds. As a result, from Monday of this week, indoor hospitality has resumed in pubs, cafes, restaurants and hotels in Wales. On Monday next, indoor gyms, spas, leisure centres and indoor children's play areas will reopen. So the Cabinet decided last week that we would devote much of the headroom available to us to provide new flexibilities for meetings between family and friends. But our discussions have recognised that this is the most risky of any easing of lockdown measures. We have therefore decided to delay any decision on this until later in the cycle. Our aim remains to restore to people some of the freedoms they have had to forego in this part of their lives, but we will only do so if the public health case can be made for further indoor meetings between family and friends can be justified. In the meantime, children under the age of 11 will no longer be subject to the social distancing rules, and new flexibilities have been introduced for family and friends meeting in the outdoors. So within Friday's announcement, I also set out plans to strengthen enforcement of coronavirus rules in Wales. While a considerable majority of individuals and businesses are working hard to keep us all safe, that is not true of all. Individuals who act as though the crisis were over run the risk of creating harm to others. That is simply not acceptable. It undermines the efforts which everyone else is making. Today, I have met separately with the police and with local authorities in Wales to thank them for their vital work and to reaffirm our shared commitment to support those who are doing the right things to protect us all. As far as businesses are concerned, and like other parts of the United Kingdom, our regulations place a direct responsibility on the person in charge of premises to take all reasonable measures to minimise the risk of exposure to coronavirus. Guidance has been agreed with the different sectors to clarify what this means in practice. And many businesses have invested time, energy and money to make sure that they can operate in a coronavirus secure fashion. To support them, we will provide new powers to local authorities to intervene quickly and decisively where this is not the case. And this will include requiring premises to close if necessary. Regulations will be laid on Friday of this week, the 7th of August, and will come into force on Monday, August the 10th. Finally, so as to look ahead to the end of the cycle which has already begun. The Chief Medical Officer for England, Professor Chris Whitty, has warned there that easing the lockdown may already have reached its limits. Here in Wales, we have taken a different step-by-step approach, but at the end of this cycle, on the 21st of August, we will be only 2 weeks away from the reopening of schools in September. We will need to prioritise any headroom we may have at that point to ensure that this vitally important moment for our children and young people can be accomplished safely and successfully. And there may be little scope to go beyond that in the next review. All of that, Llywydd, will of course depend on the latest evidence of transmission later in August, and I will report again to members on all of that in 3 weeks' time. Diolch yn fawr.
Arweinydd y Ceidwadwyr, Paul Davies.
Diolch, Llywydd. First Minister, whilst rates of Covid-19 remain relatively low across Wales, as you refer in your statement, the number of patients infected with coronavirus while in hospital in North Wales have unfortunately risen. As you've said, Wrexham Isle Hospital has recently seen a spike in cases and has the highest recorded number of cases per 100,000 population in Wales. First Minister, clearly there's an issue with infection control in North Wales, and that is under a health board that your government has direct control. Can you therefore tell us why the infection rates in Wrexham Isle Hospital have increased recently? And can you also tell us what immediate actions you are taking to address the increase in infection rates in Wrexham Isle Hospital, given that you say you are taking some actions? And can you reassure the people of North Wales that these outbreaks will now be contained, given that you are directly responsible for the delivery of health services in that area?
Well, Llywydd, I want to be clear that actions have already been taken at the Wrexham Isle Hospital. The position has stabilised, as I said in my statement. There were 76 cases in the previous 7 days, and that had fallen to 27 in the last 7 days, a 64% fall. And across Wrexham, the incident rate, which on the 26th of July was 61.8 per 100,000, has fallen to 19.9% in the last 7 days and continues to fall. So the position in Wrexham has been significantly brought under control and continues to improve. And that is because of the actions which the hospital itself has taken, mandating the use of face masks, new physical screening installed, a single point of entry for the public, testing of all patients on arrival by whatever route they arrive at the hospital. When those patients are screened, those who are suspected of having coronavirus are transferred to a side room on a COVID positive ward and are nursed by a separate nursing team. Those with no symptoms are cohorted until swab results are available. Patients with a positive result are placed on a COVID positive ward, and patients with a negative result are transferred to general bed use. As far as staff are concerned, all staff at the Isle Hospital are being tested. 600 of those tests are already booked. Staff are restricted in movements across the hospital. Agency staff are restricted to particular wards. Thousands of additional items of PPE have been provided at the hospital. A comprehensive suite of measures, with more measures being added every day. And so, as I said, the success of those measures already evident.
First Minister, as you've referred in your statement, in recent weeks, we've seen the gradual reopening of businesses and facilities, which means that people are interacting more and more, whether it's at work or in the community. However, many people have been in touch with me, confused about being allowed to eat at a restaurant indoors with people from outside of their household or extended household. Now, as you know, the UK government scheme Eat Out to Help Out is there to encourage people to support the hospitality industry, and many people are keen to support their local restaurants, cafes and pubs. However, given that there have been no changes to the policy on social bubbles, I'm sure you can appreciate that meeting more people outside your household or extended household in hospitality settings will then cause that confusion. Can you therefore tell us what the Welsh Government's current position is on support bubbles and when the Welsh Government is intending to allow any specific changes to that policy, given that you say in your statement that you will look at it later in the cycle? And can you tell us how confident the Welsh Government is about any further relaxation of social distancing regulations between people now that restrictions have been relaxed to allow people to return to work and interact further in the community?
Well, so as I set out in my statement, there will be no relaxation of social bubbles, the ability of people to meet indoors, until Friday of next week at the earliest. We will review the very latest information on circulation of the virus on Wednesday and Thursday of next week, and then make a decision which will be announced on Friday. Our caution in providing further freedoms to people to meet indoors is based on the evidence that we see elsewhere in the United Kingdom. 70% of all new infections reported in England, Public Health England attribute to household contacts. So people are not catching the virus in large numbers in the workplace or in restaurants or meeting outdoors. But 7 out of 10 new infections are as a result of the way that people interact inside the home. And the more we allow that to happen, the more opportunities we provide for the virus to recirculate. And if you provide this virus with new opportunities, it will recirculate. And that is why we have taken the precautionary approach that we have in Wales. Now, if the virus remains effectively suppressed in Wales at the end of next week, then I would like to be able to go further than we are at the moment to allow more opportunities for family and friends to meet indoors. But we won't do that if the evidence is that that would add to the risk we face in Wales in a way that would encourage the virus to be back in circulation. And the member I know will understand that our precautionary approach is further reinforced by the way in which liberalisation of measures across our border, and today in Scotland, as you will have seen, have had to be reversed because the virus has sprung up again. So it's a very careful and difficult balancing act. We will pursue the data as ever and make a decision by Friday of next week.
Weinidog Plaid Cymru, Adam Price.
Diolch, Llywydd. Mae'n galonogol iawn bod nifer yr achosion newydd a recordiwyd yng Nghymru yn isel, bellach yn gyson yn y degau, nid dros y cant. Ond nid dyma'r adeg Prif Weinidog i ni fabwysiadu strategaeth o ddileu'r feirws, strategaeth zero Covid fel ei gelwir, gan unioni yn hunain a sylwadau Prif Weinidog yr Alban a ddwedodd wrthnos diwetha bod angen i bob gwlad yn y Deyrnas Gyfunol gefnogi cynllun o'r math. Yn ôl yr athro Susan Mickey, sydd yn aelod o bwyllgor SAGE, mae strategaeth ddileu yn llawer mwy ymarferol yn ynysoedd Prydain o gymaru a chyfandir Ewrop. Ar y cyntaf o'r Orffennaf, gan gyfeiriad nifer o wledydd ar draws y byd sydd wedi cofleidio'r strategaeth yma llwyddiannus, mi ofynnus i chi wneud cais i'r gell ymgynghori dechnegol, edrych ar fabwysiadu polisi o ddileu'r feirws yng Nghymru. Ellwch chi ddweud beth dath o'ch trafodaethau gyda'r gell ymgynghori ac a ydych chi yn cefnogi galwad Prif Weinidog yr Alban a gyda astudiaethau yn America a'r Eidal yn dangos bod plant nid yn unig yn trosglwyddo'r feirws ond hefyd yn grŵp oedran sydd yn gyrru'r feirws mewn modd arwyddocaol. Pa asesiad i chi wedi wneud o effaith hyn ar eich strategaeth o ran Coronafeirws yng Nghymru?
Wel, diolch fawr i Adam Price. Dwi wedi cael cyfle yn barod i siarad gyda Prif Weinidog ar Alban. Dwi'n siarad da hi unwaith eto cyn diwedd prynhawn heddi. A beth dwi wedi siarad da hi yw, dwi'n meddwl ni'n yn yr un lle. Yn Saesneg, uchelgais ni yw i cael the lowest possible level of suppression of the virus, and then to sustain that lowest level of possible suppression by the actions that we are taking. And I think that is very consistent with what the First Minister of Scotland has set out as as her ambition. And of course, we continue to discuss this and other actions with her and with the Prime Minister and First Minister of Northern Ireland as well. Adam Price quite rightly points to the challenge of reopening schools after the holiday period. It remains our firm ambition to do that. He will have seen, I'm sure, the Children's Commissioner for England statement today about the harms that are done to children from not being able to resume their education, social harms as well as harms to their education. We will continue to follow the evidence over the rest of this month. And as I said in my opening statement, if we have further headroom in Wales when we get to the 21st of August, for the 3 weeks beyond that, then the reopening of schools safely and successfully will be our very top priority for any room for manoeuvre that we may have.
Data from the Office for National Statistics recently published showed that the mortality rate for Wales was 2.78% higher than the average mortality rate between 2015 and 19 in the first 6 months of this year. It's important to acknowledge that that was lower than both England and Scotland, but Wales nevertheless was ranked the 5th highest country for excess deaths in Europe over that period. Why does the First Minister believe we fared badly compared to other European nations? On the 28th of March, my colleague Rhys ap Iorwerth wrote to the Health Minister urging the Welsh Government to adopt an earlier intervention strategy for individuals displaying COVID symptoms, similar to that adopted in some European countries. In response, the Minister recognised the emerging evidence that early intervention was proving effective in treating patients. Why, therefore, did it take until June the 16th, more than 2 months later, for the clinical advice to change? And why has it taken until yesterday, more than 4 months since the Minister acknowledged the evidence, for a statement to be made confirming that resources will finally be made available to help GPs to make more use of pulse oximetry, as we have consistently urged? Isn't it the case, First Minister, that hundreds of lives could have been saved potentially if this had happened sooner?
Well, so is neither he nor I know whether that is true, and never will be able to. It's a very unhelpful speculation, it seems to me. It is true that we have seen excess deaths in Wales over the coronavirus period. I'm very pleased to say the deaths in Wales over recent weeks are below the 5-year average, so we're now in much calmer water as far as that is concerned. Why the United Kingdom has experienced higher levels of excess deaths than other European countries will be the matter of research, I'm sure, in the future. The fact that Wales has a lower rate of excess deaths than either England or Scotland also needs to be understood better. On the surface, you would think that was counterfactual. We have an older, sicker, poorer population than across our border, and our excess deaths figures normally reflect the nature of that population. The fact that the opposite has happened during the coronavirus crisis will need some research to understand how that was achieved, and it's no comfort in any case to those families who have lost loved ones during the pandemic. The member asks why things were not done in March and April in the way advocated by his health spokesperson. Well, the truth is that the health service was flat out dealing with the peak of the coronavirus crisis, with many hundreds of people coming through hospital doors, already requiring critical care, beds and provisions. And while there were steps being taken to improve prevention, and certainly in the autumn we will know more about the way in which early intervention can have a positive impact on the progress of this disease, at that point in the curve of the pandemic, the focus of our system was and not being overwhelmed by the demand that was already generated by the circulation of the disease. We've now been able to confirm funding for a whole range of things that we will be able to do during the rest of this year, following confirmation from the UK Treasury of the money that will be available to Wales. And as soon as we were able to confirm those figures, we published detail of how that money will be used. And as the member says, we will be able to do more in providing primary care with the pulse devices that they will need to measure oxygen in people's blood, an early and sometimes not easy to detect indication that coronavirus is taking place.
Arweinydd Plaid Brexit, Mark Reckless.
First Minister, may I thank you for your statement, and also thank you for the continuing extraordinarily hard work that you've been putting in. We've been on recess. I suspect you're not going to have the chance to get away on a holiday that perhaps some others may, and I know your workload has been extraordinary, so thank you for that. You're speaking about the aim of the regulations. At the beginning, I thought we were told that it was to protect the NHS, the capacity of the NHS not to be overcome. It seems relatively early in the process that was achieved. When Adam Price invites you to say, do you intend to eradicate, is that the aim? You don't say yes to that. I had thought there was not allowing R to go above 1 was a key aim. I've questioned that before. It seems to me that prevalence is at least as important as R. I think in your remarks just now, you did give more focus to that than perhaps we've had before. But the ambition of the lowest possible level, I don't see how practically that assists in making decisions, particularly when R is low and volatile. You mentioned prevalence rates of 0.7 and 0.8% compared to 4% with the emerging concern standard, at least from the biosecurity. And you talk a lot about headroom, but how do you make these determinations? Surely there must be some degree of cost-benefit analysis involved. When you look at the thankfully far lower level of deaths and serious hospitalizations we now have, but the still pretty severe restrictions people and their well-being and the economy operate under, when people think about whether they're going to interact, the chance of getting the virus in is generally very low, yet the cost of not having those interactions, socially as well as economically, can still be high. And I'm not clear how you're determining what is eased and what is not. And you talk about headroom, but that ambition of a lowest possible level doesn't give a quantitative standard against which you can make judgments. We also still have a huge amount of detail and complexity and micromanagement of what people should or shouldn't do, and whether it's in law and whether it's in regulations, and a bit different in Wales and in England. And when you complain about people not following their precise instructions, many people find it very difficult to keep up with what they are. And if they perceive the risk is very low, yet the cost to them of not doing something or not having an interaction, and many people will do that. Do you not sort of understand that? We had 59 million for the arts. You mentioned that that was passed on, yet only 53 million of that has been distributed in Wales. What are you doing with the other 6 million? One area I've had complaints to my constituency, the David Broom Equestrian Centre in Chepstow, say competitors across the border, they're fine, but because of the law and what you're doing in Wales, they can't have show jumping events, and the 30 limit on anything outdoors, even if people aren't very connected, applies. Is there anything you could do to assist them? My colleague David Rowlands wrote to you 10 days ago, but has not yet heard back. Finally, I think people's confidence and assessment of risk matters at least as much as what the law or the precise guidance is. Can you be clear to people? Do you want people to go back to work when they can, or are you still saying people must stay home when they can? We have only around 1/3 of office workers back at work. That compares to about 3/4 in most European countries. Aren't we going to see absolute economic devastation while that remains the case?
Well, shall I thank the member for what he said in introducing his question. He asks how we make the calculations that we do, and I can explain the process that we go through very briefly. This is the first week of this current 3-week review. What will happen across the Welsh Government is that we will compile the longest list we can of all the different things we might yet do to lift restrictions, both on businesses and on individuals, and equestrian centres, as it happens, are on that list. We will then take advice from the Chief Medical Officer by the end of this week, and at the start of next week we will begin to narrow that list down to those things which we think have the most pressing cases for being ameliorated. And then we judge that in the 3rd week against the latest information we have across a whole range of indicators about the current prevalence of the disease in Wales. And it is that that gives us the sense of how much headroom we may have and which measures we are able to take. We are guided by the advice of SAGE and the World Health Organization in only taking one step at a time. So there is a chance of connecting the action you take and the impact that it has on the circulation of the virus. The difficulty, I think, in the members' sort of view of things is this, that this is a virus where you can go from effective suppression to widespread circulation in a matter of just a few weeks. So in Melbourne, in Australia, 4 weeks before 5 million people have gone back into lockdown, there were days when not a single new case was being reported amongst those 5 million people. Not a single new case. And 4 weeks later, the virus is in such violent circulation that all of those 5 million people have to go back into a more stringent lockdown than at any time previously. And those measures have had to be further increased as the state of Victoria declares a state of disaster. Now, if you are separated from where we are today from a state of disaster by only a few weeks, you cannot afford to take a sunny and optimistic view of how the virus will operate in Wales. And that's not the way that we do it here in the Welsh Government. On 2 specific questions, Llywydd, that the member mentioned, as far as the arts is concerned, he didn't refer to the £16 million we had previously provided to the arts in Wales from within our own resources. So the cumulative investment in the arts well exceeds the consequential that we received for that purpose. It's not £6 million less, it's about £10 million more than we received. And our advice to people in Wales is if you can effectively work from home, it's still preferable that you do that. Now, work effectively is the right phrase. If you can't effectively work from home, then the case for returning to work is stronger. But here in the Welsh Government, for example, where we have been operating with almost everybody working from home, we have found we are able to do that very effectively indeed. And I do not want to see people in large numbers return to workplaces where that is not necessary for the efficient operation of this organisation. Far better, from an environmental point of view and from a public health point of view, we build on that success and allow more people to work from home for longer.
Arwyn Jones.
Diolch, Llywydd. The First Minister, I've noticed over the past few weeks that where restrictions are eased in many places such as shops, restaurants, pubs, that in fact people are still reluctant to go out and to spend money in those businesses. I was in Cardiff last week, for example, and shops are open, but the city centre was pretty empty. I have just outside my constituency the MacArthur Glen shopping village. Again, shops close early there in the evening because the footfall isn't what it should be. And the concern I have is that restrictions are eased, but it takes some time for the public to actually move back to a state of near normality when it comes to spending money in those businesses. Do you share my concern then that if furlough comes to an end in October, we will then see a real spike in jobs being lost because there will be a gap between furlough ending and something close to normal commerce resuming? If you share that view, what discussions do you intend to have with the UK government about what support might be put in place for businesses post-furlough?
Shall I thank Karen Jones for those points. He's absolutely right. Right across the world, we have seen that to reopen their setting is one thing, to persuade people to return to it is another, which is why in Wales we put such a lot of emphasis on building up the experience of doing things successfully, because where people can see that their well-being is being properly thought of and mitigation measures are properly in place, then I believe we will see a build-up of return in the economy, and we certainly want to see that here in Wales, but it does depend upon the confidence of individuals growing as businesses demonstrate a success. Carwyn Jones is right as well, Llywydd, to point to the fact that for many sectors, by October, coronavirus will not be over as far as an economic crisis is concerned. I fully understand why the Chancellor cannot go on providing a furlough scheme where businesses are able to get back to what was previously normal. But what we have put consistently to the UK government is that they shouldn't regard the end of furlough as a blunt instrument, that it should be a tailored scheme in which those sectors which will need some continued support design that support with the UK government to allow those businesses to emerge from coronavirus and to be successful businesses again in the future. I think that's in the interest of the economy. I think that it's an investment that the Chancellor should be prepared to make, not simply regarded as a further expenditure, because those businesses are the tax-paying businesses of the future. And some help for them beyond October will put them into that position later next year. We make those points whenever we can in conversations with the Prime Minister in the finance quadrilaterals that my colleague Rebecca Evans attends, in the meetings that Ken Skates, as the Minister for the Economy, has with his counterparts. A tailored approach to the scheme rather than what is currently planned, a blunt and rapid end to it in a way that will damage businesses which are just beginning to get back on their feet.
Andrew Arty Davis.
Thank you, Presiding Officer. First Minister, thank you for all you're doing in the current crisis, and in particular the time that you're having to spend at your desk in the office making key decisions for the benefit of Wales. In your statement, you touch on the point about Wrexham Myler and the outbreak in Wrexham Myler, and that has been a focus of considerable energy. Why hasn't the government assisted the Health Board and Public Health Wales in making it mandatory for people to wear face masks in such settings such as hospitals and care homes, when the evidence clearly shows that will be of assistance, and Public Health Wales and the Health Board have made that request? The government does not seem to have backed that request with firm action. Can you explain why that is the case, please? And secondly, in your statement, you touch on testing. And whilst it's pleasing to see that testing results in some areas have been positive, you talk about 95% return rate in 24 hours. Regrettably, we know nationally some of the figures have been as low as 26, 27% return rate in 24 hours. That clearly is not acceptable and will not achieve an acceptable return rate in the testing regime. What actions are the government doing to nationally increase the return rates closer to the 90% so that we have an effective testing regime here in Wales?
Thank Andrew Arty Davis for those questions. Well, to be clear, face masks are compulsory in the Wrexham Myler and have been since the outbreak was declared. And the view of the Welsh Government is that face masks should be used where there is a clinical case for doing so. There isn't a clinical case for wearing them in places where the virus is in such suppressed circulation that they do not add anything material to people's protection. But where there is a case, a clinical case for them being used, of course they should be used, and they are in the Myler because of the situation there. As far as test turnaround is concerned, Llywydd, as I said in my statement, 13,330 tests were returned last week within 24 hours, the highest number ever. But I want just to make this one other point to Andrew and for others. At the moment, the way we record these things in Wales is we record every test as though it needed to be back within 24 hours. and that simply isn't sensible. Anybody who is symptomatic, anybody who is going into a hospital, anybody who is being tested in the community in Wrexham, those needed to be back as rapidly as possible. But we carry out thousands of tests in care homes every week on people who aren't symptomatic at all on a surveillance basis. That the case for turning those around in 24 hours really is very weak indeed. And it would be very difficult for care homes to do that because they rely on shift patterns and running the home in the way that they do. And it takes them longer than a day to return the test that they receive to the lab. And the clock starts ticking on the moment they receive the test, not the moment that the lab receives the test. Now, we record all of these as though every test were equally urgent. That is not a sensible way to do it, and it puts perverse pressures into the system. So what I want to do is to be able to report to people in Wales on all the tests that we carry out, the ones which 24-hour turnaround is clinically important, and ones that are being done for surveillance purposes, where if it takes 48 hours for the results to come back, it really doesn't matter from a clinical point of view. Last week, the prevalence rates for staff in care homes, with all the people we test every week, was 0.1%. And some of those will turn out to be false positives as well on retesting. The case for pressurizing the system to get them back in 24 hours isn't good. And we must make sure that those tests don't get in front of the ones where the clinical case for a quick turnaround is genuine.
Rhina Piorwerth.
Diolch, Llywydd, dau beth a'i drefyn drwyddyn nhw'n sydyn. Madam Price wedi sôn yn barod am arafwch y Llywodraeth yn ymateb i'r galw am ymyrraeth gynharach o ran triniaeth ocsigen a'i atgoffa'r Prif Weinidog. Mae'r rheswm oedden ni'n galw am hyn oedd mwyn tynnu'r pwysau ar y gwasanaeth iechyd a cheisio achub bywydau. Peth arall sy'n debyg o fod mewn peryg o gostio bywydau, dwi'n meddwl, ydy arafwch ail gyflwyno gwasanaethau yn yr NHS. Dwi wedi sgwennu at gadeirydd bwrdd Betty Cydwelyd heddiw yn rhannu rhwystredigaeth meddygon orthopedic yn ysbyty Gwynedd sy'n wir eisiau cael dechrau efo'i gwaith electif eto. Mae yna bron i 2,000 o gleifion yn aros dros 36 wythnos. Swn i'n hoffi ymateb y Prif Weinidog i hynny. Ond hefyd, wrth i ni drafod llacio rheoliadau llacio cyfyngiadau heddiw, dwi eisiau gwybod mwy am barodrwydd y Llywodraeth i dynhau rheoliadau lle mae angen. Dwi hefyd eisiau gweld rheolau llymach ar orchuddion Wynedd. Ond hefyd, mae yna sawl ardal o risg uchel wedi cael ei hadnabod rwan. Ardal Wrecsam, rhan o ogledd-orllewin Lloegr. Mae miloedd o bobl o'r ardaloedd wrth gwrs yn dod i lefydd fel yn etholaeth i ar ei gwyliau ar hyn o bryd. Os nad yw'r Llywodraeth yn barod i ddeud wrth bobl beidio teithio, ydych chi fel cam lleiaf yn barod i gynyddu'r cyfathrebu ynglyn â sut y dylan nhw ymddwyn ar ôl cyrraedd, oherwydd mae yna beryglon wrth gwrs o bobl yn mynd i dafarndai bwytai ag ati neu yn gorgroni mewn niferoedd mawr.
Wel, Llywydd, i ymateb y pwynt ola i ddechrau, wrth gwrs ni'n cydnabod mae bobl yn dod i Gymru o'r Loegr, a ni'n wedi weld beth sy'n wedi digwydd yn Lloegr. Does dim pwynt, dwi'n meddwl, jyst i ddweud i bobl peidio ddod i Gymru heb cael pethau yn ei le i reoli hwnna, a dwi ddim yn meddwl mae hwnna'n ymarferol i wneud. So i gryfhau y negeseuon, dwi'n cytuno dy hwnna, a ni'n dweud bob tro i bobl, os ydych chi'n dod i Gymru, helpu ni gyd i cadw'n Cymru diogan. Ac ar ran fwyaf o bobl sy'n dod i Gymru, dwi'n siŵr, mae nhw eisiau wneud hynny, fel wedais i yn y datganiad, pan ni'n weld bobl sydd ddim yn fodlon i cydymffurfio gyda reoliadau yng Nghymru, ni'n mynd i cryfhau y pwerau sydd dar yr awdurdodau lleol, gweithio gyda'r heddlu ac yn y blaen, i bod yn glir da nhw, os mae bobl ddim yn fodlon i cydymffurfio gyda'r sefyllfa yma yn Cymru, ni'n fodlon i wneud pethau, i bod yn glir da bobl am y cyfrifoldeb debau nhw, a dwi wedi siarad bore yma gyda'r arweinydd Cyngor Sir Gwynedd, a dwi'n siŵr, a dwi'n gwybod mae nhw'n awyddus i wneud popeth mae nhw'n gallu wneud yn yr ymdrech hon. As far as returning to normal activities in the health service, we have used part of the headroom that we have had over the last 4 cycles to begin to return the health service to its more usual activities. It's why we've been able to reopen services in the community. It's why we've been able to reopen screening services. The very hard end will be operations of the sort that Brina Biorath referred to. Productivity in an orthopaedic theatre in pre-COVID times was up to 8 operations in a day. Under COVID conditions, that will fall to 3 operations a day. And that is a real challenge, and it's a real challenge to every health service. With all the protections we will have to put in place in future to prevent additional risks to patients and to staff, even if our theatres are working flat out, they will not be able to carry out the number of operations that were previously planned and expected. That will be a challenge for the health service going into the winter particularly, and will require conversations between patients and their clinicians. But there is no easy answer to it, and it is not for lack of effort on the part of clinicians or health boards to resume those activities. It's just that in a coronavirus context, it simply isn't possible to return to the sort of working practices that were safe back in January and February of this year.
Weinidog.
Thank you, Llywydd. First Minister, I was very encouraged by your answer earlier to Adam Price, as I'm personally very keen to see the Welsh Government commit to a zero COVID strategy for Wales. I was also very heartened by your restatement of your commitment to prioritise the reopening of schools. And of course, the other point that the Children's Commissioner for England made was that schools should be the first to open and the last to close. And that is also something that features in the scientific advice that the Welsh Government has received on the reopening of schools. Now, I am very uneasy about the decision to reopen pubs indoors and the impact that will have on our plans to reopen schools. So can I ask you how you will take forward that prioritisation of children and schools, especially in light of what's happened today in Aberdeen, where I understand the outbreak has been linked to a pub. I'd also like to ask you about supermarkets. As you know, I'm really worried that many supermarkets now have abandoned one-way systems, restrictions on numbers, etc. And many of my constituents tell me that they don't feel safe going to the shops. What will you do, First Minister, to ensure that essential shops understand the need to maintain social distancing in Wales? Thank you.
So thank you, Neil, for that. And happy to repeat, the Welsh Government's position that reopening of schools will have the top priority in whatever capacity we have to go on lifting lockdown measures in the second half of this month and into September. Our approach to dealing with any flare-ups we see as a result of other measures we have already taken will be similar to that you have seen in Scotland today and in England already, that we will introduce local lockdown measures, effectively to suppress the circulation of the virus in those localities, as I think we have demonstrated we were able to do in Ynys Môn, in Merthyr Tydfil, during the earlier part of last month. And that the range of measures that we will take on a local basis will depend upon the nature of the outbreak. And there will be a menu of actions that local outbreak control teams will be able to draw on. And my colleague Vaughan Gethin will be publishing further information for members, I think next week, hopefully, which will set out our approach to how a local lockdown might be triggered, who will have the powers to take actions, what the menu of actions might be, and what the process will be from withdrawing from a local lockdown as its effectiveness takes hold. And in that way, we hope we will be able to avoid the need to take nationwide measures, particularly measures that would have an impact on children. So as supermarkets are concerned, my colleague Leslie Griffiths met with the supermarkets in Wales this morning. She emphasised to them that the law is different in Wales, that they have a legal obligation, not simply advice, that requires them to take all reasonable measures to make sure that their premises are safe for staff and for people who shop in them. She received a series of assurances from the sector and an undertaking that they would go away and look at some of the complaints that have come into my office and to other members here offices as well about the way in which some supermarkets are operating locally. They are very, very important sectors, and they've managed fantastically during the coronavirus crisis to keep open and to go on feeding people in Wales and the rest of the United Kingdom. But they have a responsibility as well. And here in Wales, we are very determined that we will make that responsibility clear to them and that they must live up to it.
Nick Ramsey.
Diolch Llywydd, and thank you for your statement, First Minister. A couple of questions from me. And firstly, and this was covered in an answer you gave to a question, partially covered in an answer you gave to a question a few minutes ago. With regard to the health service and operations, a number of constituents have contacted me who have had operations deferred due to the COVID-19 situation. I appreciate what you're saying about how it's difficult for things to return to normal in the near future and the capacity isn't there, but I need to give some kind of guidance to my constituents. So I wonder if the Welsh Government can be quite clear, provide clarification on when operations that have been deferred can resume and when we can expect some sort of normality. Secondly, sport and covered riding arenas have been allowed to reopen both in Scotland and England. I think in Scotland on the 29th of June and England on the 4th of July. I don't believe this is the case yet in Wales. So could you provide some clarification or could you raise this with the Minister responsible so that we know when we can expect covered arenas to at least partially reopen in Wales? And finally...
no, there's no chance for a finally.
No? Okay.
I'm sorry. Thank you, Nick. First Minister.
Thank Nick Ramsey for that. Operations have resumed in Wales. Operations are happening every day. It's a matter of clinical prioritisation. The rule in Wales will always be that those with the greatest need will get the first service. And that's a matter for clinicians to discuss with their patients. I don't think there will be a more precise rule than that. And the advice will generally be people have to discuss it with their consultant and get advice in that way. On covered riding arenas, I have already discussed this earlier this week with the Chief Medical Officer and others. It's part of the current 3-week review. And if we're in a position at the end of it to make further liberalisations, those organisations in Wales that operate in the equestrian field can know that we are actively looking at what we can do for them.
Leanne Wood.
Diolch Llywydd. Many parents have contacted me with concerns about the restricted bus places for schools. There are problems on all buses affecting key workers too, but the school bus places shortage is causing particular stress to those parents with children in different schools, to some parents with children in Welsh medium schools, to those people who've previously paid for a place and no longer can. So what do you say to those parents, including the mother of an autistic child who's unable to get a bus seat for her son to get to school on his first day of secondary school? And how are you taking into account the 2 studies published by the JAMA Paediatrics Network, which suggests that young children spread COVID-19 more efficiently than adults, presenting a clear risk to those vulnerable relatives? It seems to me that it contradicts your announcement to end social distancing for the under 11. So will you publish the advice that led to that decision? And will you undertake to consider this new research and its impact, particularly on the most vulnerable of our citizens?
We publish the advice on a weekly basis, so the member will see all of that, as she will already have been able to see all the evidence we have published on childhood transmission and childhood vulnerability. These two studies will be looked at by our technical advisory group, and if it changes their minds, then they will tell us that. But the preponderance of evidence has been on the opposite side of that divide, including in places like Denmark, where they have longer experience already of children returning to school. So there's more than one study here, and the weight of evidence is not on the side that the member has identified so far. And on bus places, we continue to work with local authorities and with bus providers to make sure that, to the maximum extent possible, we are able to provide effective school transport for children returning to school in the autumn.
Jenny Rathbone.
Thank you, Clywyd. I fully support the government's position of prioritising the return to school of all, hopefully of all pupils for the start of the school year next month. And linked to the important change to the regulations last Friday, that children up to the age of 11 no longer need to observe social distancing, either with each other or with adults. I'm keen to understand how that will facilitate the reopening of all primary schools for all pupils full time, and also whether that will then enable breakfast clubs and after school wraparound service is to operate normally as well, because I'm sure that parents who will otherwise need to make other arrangements for childcare will find that very helpful. Assuming that the information from Denmark and elsewhere stands up to scrutiny, and that primary school children are not a source of spreading the coronavirus, that obviously enables us to focus more on the secondary schools where social distancing is required. And I wondered how the government is supporting secondary schools to ensure the maximum number of pupils can attend most of the time. And lastly, I just
no chance for a lastly for you either. Sorry, Jenny. The First Minister.
Well, so I thank Jenny Rathbone for her very solid support throughout this for children and the need for those children to be back in school. The science does change in relation to coronavirus. Members of Plaid Cymru have pointed to further studies today which need to be taken into account, but the bulk of evidence that we have seen is that children don't spread the disease and that they don't suffer from the disease to the extent of others. And children suffer in other ways. And children under the age of 11 told that they've got to keep a social distance from people who they love, and other children that they know suffer through that as well. So I was very glad on Friday that we were able to say that the evidence tells us that we can lift that restriction on their lives, and it ought to mean that the reopening of schools in September will be easier in that way. It's not the only part of the picture, as I know Jenny Rathbone knows. There are adults in school that we have to think about. Lots of the risks at school are not posed in the classroom, they're posed in the way that people arrive at school and leave school, all the things that happen around a school. So head teachers will still be thinking carefully about the fullest extent to which they are able to reopen, including breakfast clubs and after school clubs and so on. And in secondary schools, we uniquely in Wales have the advantage of the fact that children were back in secondary school in the end of June and into July, and head teachers have learnt a great deal from that. We're doing a lot with the sector to make sure that that experience is shared and that teachers are able to return to the classroom with children of secondary school age to the fullest possible extent. We're offering some extra flexibility at the start of the school term to allow people to make adjustments in those first couple of weeks, and then our aim is to have as many children back for as long as possible, because that is in their interest, as our own Children's Commissioner, as well as the Children's Commissioner in England, have so very powerfully articulated.
Neil Hamilton. Not hearing you at the moment, Neil Hamilton. Yes.
In the course of his statement, the First Minister said that the outlook for coronavirus has darkened in many parts of the world, but one country where that is not the case is Sweden. Sweden's had 81,000 cases altogether since the start of the pandemic, but as of yesterday, only 41 people were registered as being in a serious or critical condition, and the 7-day moving average of deaths has now been reduced to between 1 or 2 per day. At the start of the lockdown, Sweden took a radically different course. It didn't have a compulsory lockdown at all. And Professor Tegnell, who's the chief advisor to the Swedish government, said that the lockdown would merely postpone infections and deaths and wouldn't prevent them happening. And that seems to be borne out by experience in England, to which the First Minister referred. On that basis, therefore, would the First Minister agree with me that whilst people must continue to take sensible precautions on their own responsibility in social distancing and avoiding creating risks for those who are vulnerable, the elderly and those with underlying medical conditions, it is now vitally important that we get the economy as up and running as much as we possibly can, because not only is there an economic cost to the lockdown, but also, of course, there's a cost in people with cases of serious diseases which go undiagnosed or untreated, and therefore we should be measured in our response and not panicked by these recent outbreaks in other parts of England.
Well, Llywydd, the member's conversion to the cause of Scandinavian social democracy has been one of the phenomenons of the whole coronavirus experience. And the position in Sweden is a great deal more mixed than I think he wishes to imply. More deaths in Sweden than the whole of Denmark and Norway combined, and with their care home sector particularly badly affected. So nobody should believe that there is a single shining example to be found even in Sweden. But on the general point, I don't disagree with what the member has said. We want the economy in Wales to reopen. We want people to have livelihoods in front of them and businesses to succeed. But it's why we have gone about it in the way that we have, because I think nothing is more difficult for a business than to find itself opening and then shutting, and then reopening and the risk of reshutting, because that erodes the confidence that Carolyn Jones referred to earlier in this session of the people on whom those businesses rely, their customers. And the way we have tried to do it in Wales in a step-by-step way, without at the moment having to reverse the measures that we have introduced, I think is good for business. And businesses need to succeed in what is an economic as well as a health emergency. But my argument will be that our approach to it has been good, not simply for public health, but what's good for public health is good for business. And that's the way that we try to approach it.
Finally, Jack Sargent.
Diolch, Llywydd. First Minister, I've been contacted by residents with family members who have contracted coronavirus whilst in hospital. As you can imagine, they are quite rightly scared and angry. Now, First Minister, this has happened more in North Wales than anywhere else, and people need to know that they are safe when they do go to hospital. Can you ask your officials to speak to the Health Board to ask them to review the procedures in North Wales with an aim to making sure that this never happens in the future?
So we will thank Jack for that. And of course, I understand and sympathise with those people who have relatives in hospital and who are afraid of contracting coronavirus when they are there. The facts of the matter are actually that that has been more a feature of South Wales and South East Wales in particular than any other part of Wales, including the North. But I give Jack Sargent an absolute assurance that my officials are in daily contact with the outbreak control team at the Wrexham Miler. I have met them myself twice with the Health Minister in the last 5 days to hear of the work that they are doing to make sure they've got all the help and advice that they need. And as I say, I think the encouraging news is that the position at the hospital has stabilised, that the number of new infections has been low in recent days, and with all the actions that have already been taken, I think the patients can have growing confidence that the events at the Miler are now well under control.
Diolch i'r Prif Weinidog. Yr eitem nesaf felly yw'r cynigion i ethol aelodau pwyllgorau. Dwi'n galw ar aelod o'r pwyllgor busnes i